Welcome to Maxwell Rehab Center. Bruxism or teeth grinding, teeth clenching in sensory processing disorder kids. Bruxism may be a form of focal dystonia. It is a form of stimming, a repetitive or an unusual movements which helps sensory processing disorder kids to manage their emotions and cope with overwhelming situations. It's a kind of self-stimulating behavior. It is the way of seeking the input to calm and organize themselves during stress and extreme emotional disturbances in those children with sensory processing disorder. Teeth grinding or teeth clenching may be a way of getting deep pressure or seeking out a strong proprioceptive input. It can cause vibration in the temporomandibular joints, which stimulates vestibular sense, that is a balance sense. It will be worse during stress and anxiety as their neurological system becomes disorganized, especially in those kids with autism, ADHD, or any other special conditions with sensory processing disorder. Let us see the causes of teeth grinding. In few kids, this may be because of an anxiety, anger, emotional stress, panic attack, and teething, earache, allergies, misalignment of teeth, injuries, and pinworm tapeworm infections or reaction to certain medication will lead to teeth grinding. Those kids with sensory processing disorder or sleep apnea, epilepsy, night terrors, ADHD, and autism will also leads to teeth grinding or teeth clenching behavior. In some kids, it could be an unconscious habit when the child concentrating really hard on something. Let us see the symptoms of the teeth grinding. If the child does teeth grinding in an aggressive way or a routine habit, then it may lead to headache, earache, face and jaw pain, tenderness and fatigue in the jaw. There may be problem in joints and muscles that leads to chewing issues. There may be restricted range of motions and movements of a temporomandibular joint. Teeth chattering and clicking noise in during the sleep may lead to sleep disturbances. Teeth mark on the tongue. The wearing of tooth enamel. Gums and teeth sensitivity. Teeth shape may change over a time if the child does teeth grinding for a long duration, and some kids may lose their tooth also. As far as the treatment is concerned, the option for teeth grinding is vast and varied. Finding the right root cause of the problem and right treatment method for each person may take some time. So it's a trial and error method plays a major part in finding the solution, and here are some methods that helps to reduce the symptoms of this bruxism. Mild bruxism in babies and toddler probably doesn't need any treatment. It will be corrected automatically as the child grows. Treatment needs only if it is more aggressive that can damage or wound teeth and pain begins. If your toddler do teeth grinding or teeth clenching, and if it is because of teething, then provide them with a teething toy or a teether to chew on. If your child is older, then proper oral hygiene and regular dental checkup is very mandatory. If teeth grinding is due to stress or anxiety, then try finding out the root cause of the problem so that the problem will reduce gradually, and try introducing the coping skill to the child to manage with this stress. Teach your child to relax themselves right before bedtime. You can make your child take a warm bath. Reading a book or listening to a soothing music will also relax the child. Avoid screen time right before bedtime, at least 30 minutes to half an hour before sleep, as a consistent bedtime routine. Avoiding mobile, TV, and laptop is a major thing, and make your bedroom a screen free zone. Turn off electronics to give your child an adequate time to wind down and prepare for sleep. Getting customized nighttime mouth guard which prevents damage to the teeth and temporomandibular joint. Repeated verbal commands to stop teeth grinding will helpful. It sounds simple, but habits are often done unconsciously and automatically. So a verbal reminder may help them more aware of what they are doing. Techniques that used to reduce teeth grinding in sensory processing disorder kids. Along with the other given techniques, special children, those who have autism, ADHD, or any other condition, they need a special attention, uh, like which is needed for the child. A complete occupational therapist assessment is to be done to rule out the problem, whether the child is having hyper or hyposensitivity toward a particular stimuli should be identified and treated accordingly. Regular sensory integration therapy by an occupational therapist will help the child to normalize their sensory issue that arises in the various sensory systems, and those kids with regular therapy will gradually reduce such behaviors. Chewing tools, teething jewelry, chewable pencil topper, oral fidgets, chew beads, carrot sticks, sensory oral chew toy or teether to relieve stress, and it will also provide the needed sensory input to those kids with proprioceptive seeking. These are some chewing toy, teething die that helps the child to relieve their stress. Crunchy or strong intense flavor chewy to organize their pressure seeking is very important. So if it is a sweet and sour flavor, then that will be more helpful. Proper sensory diet of an activity that helps the child to stimulate or self-regulate throughout the day, which includes regular and frequent deep pressure, that is a proprioceptive input, a heavy work activity to regulate their neurological system. Weighted objects such as weighted blanket, weighted vest, weighted hat, or weighted lap pad, all these will help to balance their deep pressure craving, provided only an occupational therapist can monitor and prescribe all these above items if the child is needed after a proper evaluation. Oromotor exercises will also helpful in these kids. Oromotor vibration for sensory motor needs, like those kids with biting and teeth grinding behavior. Z vibes or Z grabbers can also turn on to vibrate, which helps in increasing oral focus and oral awareness. It can be used for soothing and calming sensory processing disorder kids with oromotor issues. Gums pressure and oral massage will help a lot in those kids with sensory issues. Here are some home remedies for teething die. You can freeze a banana and allow your child to use it as a teething device, as it is very easier to make it at home. Take a slice of ginger root and peel it off and rub the baby's gum for 2 to 3 minutes to relieve teeth pain and swelling. Clean cold towel will also act as a teething dye. Provide them a moistened, chilled, washed cloth or a towel to chew on. As they chew, the chillness will reduce the swelling and helps ease some of their pain. It acts as a safe ice pack for their gums. Bagels is also a teething dye. You can make or you can refrigerate a bagel for few hours and allow your child to chew on. Create stress-free environment, that is most important. Talk to your child and make your child feels comfortable. Find out what makes the child discomfort or anxiety or fear, so that you can resolve the problem accordingly. Avoid coffee, caffeine, any drinks before going to bed. Massage your child's face and jaw muscles before sleeping. Avoid chewy food in the evening or before bed. Well hydrate with lot of water throughout the day. So Healthy sleep practice is very important, and regular dental consultation is also most important in those kids. Here are some foods that helps to reduce bruxism, because a kind of nutrition deficiency will also leads to teeth grinding problem. So feed your child with proper nutritious diet which contains potassium, vitamin B5, vitamin C, magnesium and calcium. Thank you all for watching. For online consultation or for more guidance, you can mail us to Maxwell Rehab Center.